Hello, hello, hello. This is Nurse Laconda, and I am back to you with another nurse crime. So this story today is going to be about someone in the good old US of A. His name is Nathan Sutherland. Let's first subscribe to my channel and like this video. And the nurse name is Nathan Sutherland. He is from Phoenix, Arizona. Okay, and shout out to the good old nurses in Phoenix, Arizona. Also shout out to the people in Phoenix, Arizona. This is of course a male nurse. He was actually, just give you a little history about him so you can know his background. He was actually born in Haiti, and it looked like his parents separated, and then the mother couldn't take care of her kids, so she gave them to an orphanage. He also had a sister. I don't know if the American family that adopted him also adopted her, but I think she's over here too because they so-called had a gospel rap group, okay? He was brought here to the United States in 1989, and he became a U.S. citizen in 2011. He was married to a woman named Bridget, and he had 4 children with her. Okay, he was an LPN, and he worked at Hacienda Healthcare. So in 2018, incapacitated, nonverbal 29-year-old patient at Hacienda Healthcare went into labor and had a child. She's been in this facility since she was 3 years old. Never goes home. But she got impregnated by Nathan Sutherland. So reports show that the family said, because it was a thing where, did she feel this pain when she went in labor, or was she not cognitively aware? And the family is saying, oh no, she knows when we're there. She likes to listen to music, so of course she felt this pain. So actually the girls were giving her a bath or doing ADL care, and as they were cleaning her up, they saw the head crowning out of her, and of course they were shocked, so they called the nurse. The nurse came in. The baby was coming out, okay? Nothing they could do. That baby was coming. So I guess they were helping her get the baby out. They were calling 911. They had one nurse. She was hysterical. I felt like they should have had somebody else call because that was her actual nurse. She was trying to run a rapid response and make a call to 911 at the same time. So 911 was having a difficult time trying to get the information out of her. But she ended up letting them know, we have a patient here. She's pregnant. We didn't know she was pregnant. She's having a baby. The baby is out. The baby is not breathing. The baby is blue. So happily, a respiratory therapist was there and started working on the baby, got the baby back breathing.
Yes. Phoenix 911.
Oh, the baby's turning blue. Baby's turning blue.
Okay, where are you at?
We need an RT.
What is the address, ma'am?
Baby's turning blue. Baby's turning blue.
Ma'am, I need an
Hello?
address. I need an address.
I'm sorry.
Okay, is it a house or an apartment?
No, it's a facility.
Okay, I'm going to get paramedics are on the line. You need to give them the address again.
You said 30?
30? What is it?
No, what's the unit number?
What's the unit number for what is it? What is it? For what's the room for?
Okay, what's the emergency?
Someone just had a baby. One of our patients just had a baby, and we had no idea she was pregnant.
Okay, is the baby
We were not
out?
prepared for that. Baby's turning blue. We need someone now.
Okay, all right, go in there with the baby, and I want you to walk this through, okay?
All right.
I'm going to be on the line with you. What's your phone number?
Shoot, I don't know what the phone number is for this. Give me 1 second, I'll find it for you. We have a respiratory over there with them too. The phone number is...
Okay, and the mom is doing okay?
We're not sure. We had no idea this patient was pregnant.
Okay, and the
This
respiratory
is a patient.
is doing...
We have respiratory here, and
okay,
we have
are they
nurses
doing
here.
compressions? Or what's going on right now?
Were we able to get the baby out? Is the baby breathing? Is the baby breathing? Baby's not breathing. Baby is blue.
Okay, so are they doing CPR?
Are they doing? Yeah, they're doing CPR on the baby.
Okay, good. Just keep going with that. And how's the mom doing?
Mom's doing well. It looks like she's doing well.
How far
Did you
along
get
is
a set
she?
of vitals? We had no idea this person was pregnant. We had no idea this patient was pregnant.
Okay, I understand. Does she know how far along she was or anything?
We have no idea. This is a complete surprise. We were not expecting this.
Okay, and the baby
Is the baby doing
responsive
better?
or no?
Is the baby responsive? No, baby's not responsive.
Okay, and they're still doing compressions, right?
They're still trying to do compressions and they're suctioning the baby.
Okay, good. Good. You guys are doing a great job. We got help on the way, okay?
Alrighty. Thank you. Do I just hang up with you and then just go back to the baby?
Stay on the line.
Stay on the line?
I want to see how they're doing, okay? And I need you to give me the address.
Should we get vitals on mom? Here, let's get the vital machine. I want vitals on mom. She had a baby. Look at there's a baby right there.
Okay. They're still doing compressions on the baby, right?
Yeah, and mom's doing fine.
Okay.
Mom is doing fine. We're about to take some vitals on her, but so far she looks stable.
What is your name, ma'am?
My name is and I'm the nurse.
How old is
We
the woman?
take care of. How old is? Give me 1 second. She'll be something. I can go take a look at her chart and give you the exact. Thank you. Someone's gonna go give me the chart. Oh my goodness. How are we doing with the baby?
Is there any signs of life from the baby?
Any signs of life in the baby yet? Let me see.
And they're doing the compressions with 2 fingers in the center of the chest.
Yeah.
Okay, and then 1 finger below the nipple line.
Let's see.
And then they want to push down 1.5 inches, okay?
Are you guys still doing compressions on baby? Yeah, they got the baby on an ambu bag. Are you guys still doing? Yeah, I'm on the phone with them right now. Are you still doing compressions on the baby?
Okay.
They're not doing compressions. They have an ambu bag on the baby.
They have what on the baby?
An ambu bag?
Is it an AED or what? What are you saying is on the baby right now?
They have an ambu bag on the baby.
Okay, so are they trying to resuscitate the baby?
Are you guys still doing? Because they want you guys to still do compressions. No, it's breathing. The baby's breathing. Oh, the baby's breathing. Oh my God! Thank God.
Okay.
Thank God.
Okay. Okay, and that's the baby in the background?
We're getting vitals on mom. I'm sorry, say that again?
That's the baby in the background?
Yeah, there's a baby in the background.
Is that the baby crying?
Crying.
Okay, that's good. You guys did great, okay? They're on their way.
Okay, we're getting vitals from mom right now. She looks...
Okay, so when this patient was 13 years old, something happened there with her and other patients where it might have been some allegedly assault, but it was never proven, so they could not bring charges up. But the facility let go of some of the staff regarding this incident. But at the time, she was 13 years old. Parents made the decision to not have her with male staff. But of course, Hacienda Healthcare did not follow their wishes and gave her a male staff. This woman ended up going into labor. She was full term, having a brand new baby boy without any medical care, any prenatal care, and no pain medicine through this labor. It was reports saying that Sutherland had been with this patient at least over 100 times, and he worked the night shift, so he would have this patient during the night. They said she had a large, hard abdomen. And reports showed that the baby was kind of on one side of her abdomen because she had a bowel obstruction in the past, and they did some type of procedure. So they said the baby grew on one side and not the other. Maybe because of the scar tissue inside the abdomen, the baby was only able to grow on one side. Then they were saying that the baby probably was not that active because the reason why she was there is because she had a traumatic brain injury and seizures. So she was on a medicine called phenobarbital that's given for seizures, and that medicine has a sedative effect. So they're thinking that's why the baby wasn't very active. maybe kicking and things like that, and that's why the baby came out not breathing, due to that same reason. This was a very, very high risk pregnancy, and she definitely needed care. So the doctors, they said the doctor had saw her at least 10 times during this pregnancy, according to the documentation, and he would just document that she had a knot, or she had a swollen stomach, or things like that. And then he will order, they thinking she had because she had a history of a bowel obstruction, thinking she was constipated, so he was ordering her Miralax and things like that. Never sent her out, but was ordering her stuff for constipation. A week before her delivery, they end up ordering an ultrasound, but this ultrasound never got done. But if she would have had the ultrasound, they would have knew she was pregnant at that time. At least they would have knew. I could get her in a hospital or something so she can have the baby, but they never did it. So Nathan Sutherland's wife, she divorced him, got rid of him. I don't know if she was already working on a divorce prior to this incident, but the report showed that she separated and divorced him. Okay, and I was looking at pictures of him prior to this, prior to the police picture, or the picture when he went to jail. He looked like a decent guy. He didn't look like anything was wrong with him, but on that picture he looked insane on the picture when he was arrested. It was reports saying, or staff saying, that during the time of the investigation to find out who impregnated this woman in this facility, they said he was real quiet, very quiet, wasn't really talking, but he was still coming to work. Because I think if he would have stopped coming to work, that really would have made him look guilty. But the police requested DNA from the male nurses, and he was not compliant at first, but I think they had a warrant and they got his DNA, and kaboom, the baby was his. Okay, so the DNA showed that he was the father of this child, and at that time he was arrested and charged with the R and other charges as well. People at the facility just could not believe that he did this. Like, they said he was so professional, blah blah blah, but they did say that he would be in the rooms for a long length of time. I really believe that this guy was a predator, and he was doing this to probably more than her, probably other women there as well that was nonverbal. I bet he did, but it wasn't proven. And also the family stated that she had been assaulted more than a whole bunch of times, and they think the medical examiner was saying that she seems like she had been pregnant before this. This wasn't her first time, they said, giving birth on some of the reports. So now how she did that, I don't know, but this facility seemed real shady for this to happen when she was 13, and then this to happen again. So they wasn't good with their hiring process was not good. If that family said that they did not want her at 13 years old, that was the last time they wanted her. They did not want her to have any more male nurses, and the facility still gave her male nurses. Shame on them, and they deserve everything they get. Okay. The baby was a full-term baby boy, and the family is raising the baby as of now. They took her out of that facility, and I hope they brought her home, and just whatever the money they get, they just have her with full-time care. This happened about 5 years ago, but they just released the police dash cam footage, or not dash cam, the police footage from, because the police had the cameras on their suits, and they just released that footage. And in that footage, he was asking one of the nurses, I assume she was a nurse, like, do she have male nurses? And the nurse is trying to cover, I guess, the facility, because I mean, she ain't had nothing to do with it. I guess she was trying to cover herself maybe, and the facility. I don't know if she was the DON or the nurse manager, but she was like, oh no, she's not allowed to get male nurses. I was like, girl, the jig is up. It's up, girl. Stop lying. They already know she had a baby. Okay? So the police, shout out to them because they did a great job with the questions they were asking. But the facility, I don't know if they were just in shock or, but anyway, the nurse that was taking care of her, I guess that was her, because she was in the hall and she was just crying and having a fit. I don't know if that was guilt because she didn't realize the patient she take care of a lot was pregnant, or she just was upset that she had, you know, been assaulted. I don't know, but she, you know, was taking it really hard. My thing is, I do not know, and I hate to judge how they did not know this woman was pregnant. I guess they would not think she was pregnant, but if that stomach is growing and growing, and you all have male nurses in there, I'd have thought that. I just would have. I don't know. Maybe I'm just being too critical, but even the doctors that was talking, like, I just don't understand how she had a full-term labor and no one knew she was pregnant. No one knew. And that 911 call, I said, girl, could you please talk to these people so they could know where you are? They didn't know they was at a facility. They didn't know it was a patient. She was just doing a rapid response at the same time, talking to, get her blood pressure, get her blood pressure. The baby's not breathing. The baby's blue. And they like, who, what, where, who? They asked all these questions. She's just talking to the people there, not to the 911 people. I guess they were still on their way, but come on, girl, get it together. Okay, the jig is up. The baby is here. Okay, get your thoughts and stuff together. Okay, she should have let somebody else run the code or the rapid response, and or she should have called, or she should have had somebody else call, and then she run the rapid response. Okay, this is just a sad overall situation. They don't know if the baby is going to have long-term effects, because I guess the baby is a couple, you know, about 4 or 5 or something. Maybe 4, I'm not sure. But they don't know as an adult, would this baby have any, you know, any cognitive deficits or anything. Because the baby was getting phenobarbital and other medicines throughout the whole pregnancy. And those are not safe for babies. That's a very sad situation. That was a creep. So that's it for this story on Nathan Sutherland. Please, I'm going to insert some clips to see the police footage. Please like this video, comment on this video, and subscribe to my channel. I will be coming back with another nurse crime series. Thanks for watching.
Finally obtained Phoenix police footage showing the start of a disturbing investigation at Hacienda Healthcare in December back in 2018, when an incapacitated woman gave birth at the facility. Welcome to 12 News at 6. I'm Kariba Devine.
And I'm Tram Mai. Mark has a night off. A nurse working at that facility would later be convicted for sexually assaulting the woman. The I-Team's Bianca Bono has been covering this case for years, and she joins us live now in studio. Bianca.
Well, guys, it's been over 4 years since this disturbing case unfolded, and because of backlogs in the Phoenix Police Records Department, the body camera video was only released today, still providing important insights to what went wrong in the facility and what's changed since this happened.
Thank you.
On a sunny day in December of 2018, Phoenix police responding to a 911 call that would lead to a dark discovery.
One of our patients just had a baby and we had no idea she was pregnant.
That patient was an incapacitated woman, and it was clear from the beginning she had been raped. The newly released body camera footage providing the first look at what happened inside the facility that day.
Nurse, primary care physician, we need to get all the information and all of them separated.
As police walk through the halls,
We're going to try to figure out what's going on.
the sounds of crying and confusion. Nobody knew the woman was pregnant until she was giving birth.
She never goes home.
As far as I know, I've never seen her go home at all.
Do you guys have any email? Because I guess what we're trying to figure out is,
Yeah, I understand. We have
staff or anyone that has
male
access.
staff, but it's only female care only.
Okay, so no males ever go into her room, allegedly.
Police would soon find out that wasn't true. Despite the patient's file stating she should only have female caregivers, she was sexually assaulted by Nathan Sutherland, a male night nurse working within these walls.
We only have 2. We never have them on this side.
DNA confirmed Sutherland was responsible, and he was sentenced to 10 years in prison.
Keep on